are so excited today. We've got Dr. Angelique Oliveira from Dr. Angelique. So she is a peak performance doctor and you deal with functional and longevity medicine. And I see also here that you maximize human potential through root cause healing, which I thought was really amazing, a whole holistic approach to things. And I'd just like to hand over to you straight away. Welcome.
Thank you so much for having me. Yes, that's such a wonderful introduction. Thank you. My work does sit on the intersection of medicine, mindset, and lifestyle, helping women understand their bodies and regulate their nervous system, optimize hormones, and build long-term health. So it's not just symptom relief. I'm deeply passionate about empowering women to feel strong and clear and energized and at home in their bodies. And I've got a background in medicine and then studied further into functional medicine, longevity, and hormone balancing. So I also have an honors degree in psychology. And when I was younger, I did personal training to put myself through med school. So I've got the nutrition and the exercise background, which should be the foundation of optimizing health. So it's sad that it's not taught in med school to optimize health and preventative medicine, but I really wish that would be the way we would be trained.
I'm all about preventative medicine. Okay, perfect. So we'll jump right in. One
Okay.
question that popped out straight away to me, because very pertinent, please explain the frustration of normal bloods and perimenopause symptoms. So if the two are not kind of aligning, how is this possible and how do you confirm that you've entered that stage? Is it possible?
This is one of the most common frustrations that I hear. And the reason for this is because hormones don't decline in a straight line. They fluctuate wildly in perimenopause. So you can test normal on one day and you can test completely depleted the next day. It fluctuates in your cycle. So what happens in your cycle this month and what happens in your cycle next month in that perimenopausal phase can be so variant. So when you diagnose somebody in menopause or perimenopause or not menopausal, you can't look at it in isolation. So if someone is having really life-altering symptoms and the day you do that blood, you shouldn't be telling somebody it's you're fine. You should be digging further. You should be, that's why my consults are longer. You've got to dig deep into full history. Sometimes you do a day 21 blood on a woman to look at the hormone picture. Sometimes you do a day 3 or you repeat a day 21 after looking when they actually ovulate, because some people's cycle isn't exactly 28 days and you want a blood 7 days after ovulation to see what's going on in some of the hormones. So it's very nuanced. So yes, with different reference ranges, but also you've got to read between the lines on all the reference ranges. So you can't just be a doctor that's a robot and that goes, you're not at the cutoff. You know, you've got to read between the lines and look at upper end of normal, lower end of normal, really interpret the bloods. So perimenopause is a transition and it's an instability, not a deficiency. And symptoms can show up like a decade before you actually have a change in cycle. So that's what we're not taught very well in med school is hormones, and perimenopause never is mentioned. And it's definitely something that we need to bring awareness to, because women are feeling really not all right and they go to their doctor and they're almost getting gaslit by their doctor and going, no, you're fine. And then they just feel even more helpless and hopeless because their hormones are fluctuating, their moods are fluctuating, they can't understand why. And it's a very, very hard place to be if you feel so alone. And if we create an environment where women go, this is the stage in life, and there's so many other women going through this, you feel less alone.
Yes, exactly. Okay, perfect. Can you please talk us through biohacking hormones?
Okay, so biohacking. Some people don't know what biohacking is. Biohacking is doing small incremental changes to optimize your health, your wellness. So if you think of your genetic code as the hardware in a computer, and your genes are either there or not there, but genes can be turned on and off. So if somebody has a gene for cancer, you need the gene to be turned on for it to be a risk for you to develop the cancer. And there's ways, lifestyle interventions, that can turn bad genes off and good genes on. So you can turn on longevity genes and turn off genes for disease and inflammation and things like that. So biohacking is all about the modifiable things that you can do to optimize your health. And actually, that's more powerful than your genetic code. If you look at cancers, a lot of them, the ones that are directly related to having the genetics and the ones that are actually turned on, you have more of a chance of being able to prevent a cancer through epigenetics and lifestyle than worrying about what the genetic code really is happening. So it gives you a lot of power in your life. So biohacking hormones, it's not about forcing the body, it's about supporting the systems that regulate hormones. And hormones are messengers. They respond to sleep and stress and blood sugar, inflammation, gut health, and nervous system tone. So if you focus on things that focus on that, you're going to be biohacking your hormones. So it might look something like stabilizing your blood sugar, optimizing your sleep, light exposure, reducing inflammatory load, or supporting your detox pathways, building muscle, and sometimes targeted supplements or peptides. So these are all little nice biohacks that you can do. And the biggest shift is moving from what hormones am I lacking to rather what is my body struggling to regulate itself and how can I help that? There's a lot of biohacks that you can do that we already know of in lifestyle, but I want to talk a little bit about one that not a lot of people know about, and this is infrared light.
Yes.
So infrared light can help you because one, your mitochondria help you with hormone balance downstream. So your infrared light improves the cellular environment and helps the hormones regulate. So it stimulates your mitochondria by activating a thing called cytochrome C oxidase. You don't have to worry about that. It just helps increase ATP. ATP is the energy, and the cell needs energy. And when your cell has more energy, it means you get better ovarian and adrenal hormone production, improved thyroid hormone conversion. So you want your thyroid hormone to convert in your body. So your thyroid makes hormone and your body converts it to like the turbo. You've got more resilience to stress responses and better progesterone signaling. And all of this is very important for women. What it also does, people don't know this, but it lowers cortisol and calms the nervous system. So chronic stress, elevated cortisol, it's your biggest hormone disruptor because there's a thing called cortisol steal. So when a woman is stressed and has a lot of cortisol, the building blocks to make your hormones, it kind of goes through a little funnel. It's like, am I going to make cortisol or your hormones? And why does it do that? Your body's very clever for survival. So when we were running around in the jungle and a tiger was going to eat us, our body was like, okay, before we think of reproducing, we need to run away from this tiger. So cortisol is to keep you alive. So if your body is in that state of, I need to run away from a tiger, because your body doesn't know the difference between psychological stress and physical stress. So psychological stress, your adrenals in your body is thinking a tiger is going to eat you. So you're running away from this little tiger, and your body then creates the cortisol instead of the hormones. And then you get, especially in perimenopause, you've got to first check cortisol, because it might not be that there's a problem with your hormone production. It's actually sometimes just cortisol steal. So infrared light helps with this. Then reducing inflammation that blocks hormone receptors. So inflammation is really bad. Inflammation is the root cause of many diseases. We definitely want to do everything to decrease the inflammation in our body. So red light lowers NF kappa beta. It's a driver of inflammation, the main driver of inflammation. So lowers that, which is amazing. It reduces oxidative stress. So things in your body that produce oxidative stress, it helps to just combat that, which is really beautiful, and improves cell membrane fluidity. So making a cell really work in an optimized way. It makes you more responsive to estrogen, progesterone, and thyroid hormone and insulin. So that's good. And then it also supports your detox pathways, which is crucial for estrogen balance. So it does this through circadian rhythm, through increased circulation, drainage, liver blood flow, which is really important. Also improves your insulin sensitivity. So that's one of my favorite biohacks for biohacking hormones. I think I touched on a couple of things on that. Yes, and people don't know enough about it, so I thought that's why I'd highlight it today.
Absolutely. Okay, perfect. And then can you explain to us the link between your gut microbiome and inflammation? Because you've already touched on inflammation and sort of the chronic disease link.
Yes, this is something we are not taught at med school, which I found fascinating when I did functional medicine through the Institute of Functional Medicine in America. So, what they teach us, what is so true and so misunderstood, is that gut health is the foundation for health. Always, always, always start with fixing the gut. And why? Is your command center for health. It actually regulates your immunity, your inflammation, your hormone metabolism, neurotransmitters, nutrient absorption. So when the microbiome, which is the bacteria in your gut, you've got more bacteria in your gut than you've got cells in your body. And these guys aren't just living there doing nothing. They are absolutely vital to the functions in your body. So when you have a gut microbiome that's out of balance, it leads to things like an increase in intestinal permeability, and I'm going to go into this, immune activation, and systemic inflammation, and which underlies your chronic diseases from autoimmune to metabolic dysfunction to even mood disorders. So what does this mean in non-medical jargon? What does it actually mean? So not everyone can digest everything. Everybody has some kind of food that they cannot digest. Some people, multiple foods. Some people have become so sensitive they can hardly digest anything. Why? So it starts off with not knowing what your food intolerances are when you're younger. And you just eat all the foods, and you know some foods cause you to be a little bit crampy, bloated, and it's not a consistent, every time I eat this thing, I get a reaction. It's not an allergy. It's not like, okay, if someone's got a peanut allergy, every time they eat a peanut, they blow up or they get an itch or something. And it's not an allergy, it's an intolerance. So it's different. So you can't test for the allergies because it's about intolerance, inflammation. So what happens? So say you eat, so I have a gluten intolerance. So if I eat gluten and I just consistently eat gluten, I've got this large amounts of antibodies. What's an antibody? An army your body creates to fight an invader. So my body does not like gluten, doesn't like the gliadin little particles and the protein little molecules. It does not like gluten. So it creates a little fighter army against this invader. So eat the gluten, goes into the bloodstream, your body creates an army. You do that for long enough, and the inflammation. So if you think of the tube in your intestine, and inside your intestine, you've got cells. So these are your cells, and these are your microvilli, these little finger projections that help you absorb all your nutrients. And then you also have a mucous membrane that protects the cell. That's normal in a normal body. But if you are eating gluten or whatever you're eating something that you shouldn't be eating, it causes inflammation in the intestine. So the mucous membrane disappears, so protection goes away. The microvilli atrophy, so they break down. Then what happens is the tight junctions, there's tight junctions between the cells that then open up because of the inflammation. So this is leaky gut. So then you've got your gluten little molecule comes in, and instead of going through the cell and getting digested in the cell and into the bloodstream, it comes right between the cell. It doesn't digest. It's a whole protein molecule, comes into the bloodstream, and you get a very big inflammatory response because it's a whole protein. You get a big army trying to fight this molecule. You get leaky gut. This is the root of disease. The army, your antibodies that are created, causes massive inflammation. You've got a thing also called molecular mimicry. So the army that fights that protein molecule, there's other parts of your body that look the same, and then it fights that part of your body. Like for instance, gluten. People with psoriasis and psoriatic arthritis, it'll fight. You get autoimmune conditions where you get arthritis in all different joints in your body because that joint looks like the protein molecule in the gluten, and it fights and breaks it down. So this is why something simple like cutting out a food intolerance can completely change your life. And that's why often functional medicine will start with an elimination diet, which is this investigation to figure out what are your food intolerances. Because you destroy your gut microbiome if you eat food you shouldn't be eating. Your gut microbiome is so important for female hormone health. Because if you are eating a standard American diet, the SAD diet, it's carb heavy, it's refined carbs, processed foods, it feeds the wrong microbiome. It feeds a bad microbiome instead of the good microbiome, the good guys in your gut. So the bad guys in your gut make something that, so when you break down estrogen, you've got 3 metabolites to estrogen. One of those metabolites are really bad. You want the body to kick it out. Bad microbiome guys make this thing that bring it back in. So you're recycling the bad metabolite of estrogen back into the body, which increases the chance of cancer. You don't want that. So you want to feed the good guys. How do you feed the good guys? So you make sure that you eat a diet that is full of variety, non-starchy vegetables, all the colors under the rainbow, but definitely your cruciferous vegetables you should have a cup a day, because it makes sulforaphane, and sulforaphane helps with all of this, helps to metabolize hormones and things. And so there's so many little things that people can do at home that can completely biohack their gut microbiome and decrease inflammation. And it doesn't need a pill. Functional medicine is so beautiful because so much is about educating you and empowering you so that you don't need me. Like, I teach you how to do everything and you go off and thrive.
Absolutely. Okay, perfect. So can you also explain to us what adrenal dysfunction is and how many women are affected by this?
So the adrenals aren't really burnt out, but they are just the brain stress hormone signaling is dysregulated. And we were taught that there's 3 different levels of this. We look at things like DHEA and cortisol to determine what's going on, because you can have in the initial stage normal DHEA and a high cortisol. And the high cortisol is the adrenals going, okay, I'm stressed, tiger's going to eat me. But then the system gets a little bit tired, and then sometimes what you can see is the DHEA goes down and the cortisol can be high as well. Sometimes the DHEA can actually be high. So it's a second phase of either high or low, and cortisol is high. Your third phase is hard to diagnose because people don't look at interpreting what's going on. But sometimes you can have a normal or a low cortisol, and your DHEA is a little bit disrupted. So that's how you high or low, often low. And that then means that you can't adapt to stress. So if you're not producing cortisol, you can't adapt to stress. If you've got high cortisol, you feel like your nervous system is shattered. You're on high alert. You are super vigilant and alert, and a little sound is going to startle you. And it's not a great place to be in.
No.
And it's very disruptive to the whole health in your body. What we don't do as Westerners is we don't activate our vagus nerve very well. So actually, you find in South Africa, a huge part of the female population is suffering with adrenal dysfunction because women are just carrying everything. They're just juggling everything. They've got so much on their plates. And it's very, very stressful. And if they don't feel like there's support, that stress can go up for a woman. A woman needs to feel safe. So when you're living in this perceived state of threat, juggling careers and families and emotional labor, and sometimes under eating or overtraining or under resting, this can affect the adrenals quite badly. Now, if you think of the fight or flight is your stress response. Fight, flight, freeze, fawn, this is stress response. So we are very good at operating in that. So the sympathetic nervous system is firing and firing and firing. Now, your rest and digest nervous system, the parasympathetic nervous system, needs to be activated. But we don't do these kinds of things. We don't do these modalities because they're not taught to us. And things like meditating and humming or singing and vibrating the vagus nerve is like the antidote to the fight or flight. There's an app called the Breathing Room app. It's a free app that you can download, and you click explore for free, and then you click in the search button Soul Sync, and there's Soul Sync 10 minutes for every day. And this 10-minute meditation teaches you how to hum in a way that really vibrates the vagus nerve. And it's an antidote. But a lot of people are trained in the old way of thinking of medicine. It's like, okay, give me a pill. It's easier than doing 10-minute meditation. But actually, there is no pill that is like a vagus nerve stimulator. So you really have to just go sit and do the work and meditate for 10 minutes and hum. The humming really, you can actually feel the tingles on your skin, and you just feel this release. It's really beautiful. So there's 3 things that you can do to really help your health, to prevent adrenal dysfunction. Things like meditating, walks in nature, cold plunges, journaling, just releasing, getting the emotions out so that you're not constantly in. Yes, yoga. Oh, vinyasa flow yoga. And so it wouldn't be the yoga that's like a power yoga,
No, no.
because that's exercise. It would be meditative yoga, slow flow meditation, relaxation. It's about getting not in the body, but just in a meditative space.
Yes. And release.
Yeah, release. And what you see with that kind of practice is fatigue starts to diminish. You feel a little bit more energized. Anxiety starts to go away. Sleep disturbances are improved. Weight resistance, which is from adrenal dysfunction, starts to shift. So that belly fat starts to drop off, and you get better hormone balance from something like that.
Absolutely. Yeah. I'd rather meditate than take a pill any day. I'm not really one for medication that much.
Yes.
Especially if there's a natural remedy right there. Okay, perfect. Can we chat about endocrine disrupting chemicals and how we can
Yes.
avoid them? I do know, I read something the other day about fragrances being hugely promoted as being really bad for that.
That is a fantastic question, because we do not know enough about this.
Yes.
So there is one of my favorite apps is called Think Dirty, and I like scanning the barcode of products. And I actually sometimes do I post products on my Instagram about what's in it and what's bad and stay away and this is better. So I need to start posting a little bit more about that so we can get more awareness on endocrine disrupting chemicals. So I love that you brought up this question. So endocrine disrupting chemicals interfere with hormone signaling. They mimic or block or alter hormones. They found in things like plastics, cosmetics, fragrances, cleaning products, and even your food packaging. So avoidance, I'm going to go into a couple of them now, but avoidance doesn't require perfection. You need to focus on like high impact changes, and I'm going to go through high impact changes in a second. But let me talk to you about the different kinds of endocrine disruptors. The most common one we know about is BPA. BPA is a plastic additive. So you get like water bottles that are BPA free, but actually it's better to go with glass. But you get BPA not just in these water bottles. And so drinking water from a plastic bottle, like those ones you buy from the shops, are one of the worst things that you can do. Absolute worst thing you can do, because if you squeeze them, they're soft. Those water bottles are soft plastic. The plastic leaches in, especially if they've been transported in the heat, then that plastic is just in the water. You are putting plastic in you. And we have found plastics, microplastics in placenta, in brains, in your arteries, where there's been a plaque buildup. And so it's very, very important you stay away from these water bottles. Then there's also things like food containers. So plastic food containers, things like don't heat up your food in those containers. If you buy from Woolies or something and you get those ready-made meals, take it out, or the dessert or whatever that you need to heat up in the microwave. Do not heat up plastic ever.
And Tupperware.
Yes, Tupperware, exactly. So Tupperware containers, like plastic, we need to move away from plastic. We need to just get rid of all the plastic. And like I got rid of all my Tupperware plastics. I do glass. If I can just eliminate plastic out of my life.
Chopping boards. Chopping boards as
Yes,
well.
people don't realize chopping boards. They think, oh, because it's plastic, it's
The
better.
worst.
It's the worst, because you're putting tiny little pieces of plastic into your body. So wood is great, and you can put lemon on and bleach it, but wood is great. Wood
Yeah.
chopping boards. So also the lining of cans. So a lot of people get their canned chickpeas, or especially not acidic things like your tomatoes. If you can go with bottled tomatoes, like cans are just, they've got that BPA lining in. Even the soft drinks, I don't touch fizzy drinks. In a can, that lining, BPA, so that's been sitting and leaching into the drink that you're about to drink. And actually, the BPA in cans can lead to obesity. So some of these things that I'm going to mention can really, really hinder your weight loss goals. And it leads to obesity. It can really, really hinder your metabolism. So we want to stay away from cans. So it leaches into the contents and into your body, and it influences reproductive health, metabolic systems. So that's why it's an endocrine disruptor. The next one I want to mention is phthalates. So phthalates make plastic flexible. So it's found in the packaging and toys and personal care products. So there's quite a lot of personal care products on the South African market that have phthalates in. So some of the things that I've scanned have got phthalates in. So I'm going to do more Instagram posts on endocrine disruptors.
Even
so we can
hair stuff.
Yes,
Yes, a
exactly.
lot of it.
Exactly.
Yeah.
So you need to look at, the things that help with when you've blow dried your hair, or you want it straight,
Yes.
or leaving in treatments and things. You have to be really careful which products you're putting on your hair, and yeah. So you got to weigh the pros and cons. Do you really, really want slicked hair, or do you want to be disrupting your endocrine system?
Yeah.
I
Exactly.
choose for health, as you can see. My hair's fluffy.
Mine was like that yesterday. Look out here.
Exactly. It's all right. Then we've got anchophenols. These are industrial chemicals that I was doing some research. It's actually present and detected in our rivers and our water waste in South Africa, from detergents and plastics. And they're estrogenic, so they mimic estrogen, which you really don't want. Then you've got pesticides, atrazine, widely used herbicide in agriculture, massive endocrine disrupting properties. And it's used in many agricultural chemicals in South Africa, from farming to all sorts of things. And it's in our water system through the runoff. You've got triclosan, which is an antibacterial product that's actually it interferes with thyroid and hormone pathways, and it's in some soaps and detergents and household products. So even you have to be careful. Even the stuff you wash your body with, you think that you're using something good, but actually more natural the better. And then you've got your persistent organic pollutants, which is a broader class, but it's like these forever chemicals that are really bad. It's restricted globally, but you have residues in the environment, and we do have some of that here. So to wrap up that, basically, if you want to be really careful, there's an app called Think Dirty. It's a paid for app that you can scan the barcode of products and you can see if it's okay or not. I'm just going to make some more content and think about what's commonly used products in South Africa, and just
With a really good one to do would be makeup.
yeah,
Makeup
exactly.
is definitely, yeah. Okay, perfect. So that was really great and in detail, but I want to go back a little bit to your mention of microplastics. So most of us know where they are found, how to avoid them, but I want to know, what do they do? I know we're still studying the effects of it, but what do we know so far?
Okay, so what do they do in the body? So if you think about what the studies have shown, plastics can wreak havoc in the body, cause inflammation. But if you think of what we're finding now, so if you think of if somebody's had a myocardial infarction, a heart attack, so in the clot that's caused this heart attack, we found microplastics inside the clot. So if you think of it, it increases your chances of having a heart attack if you've got plaque buildup. It's found in the placenta, so it can disrupt the exchange of nutrients to a baby. It's found in your brain. If you think of it logically, you know that plastics have got endocrine disrupting chemicals, so it's going to live in your body and disrupt your chemicals, your endocrine system. It's going to live in your body and cause inflammation. It's going to live in your body and increase your chances of getting cancers and other things. So when it causes chronic inflammation, it increases oxidative stress. Remember, I mentioned that little NF kappa beta, which drives inflammation. It increases that. So it contributes to this low-grade inflammation, chronic inflammation, which is the root of, if you think chronic inflammation in a cell, it's going to age that cell, and that cell is going to become disrupted. And when that cell tries to replicate its DNA, you're going to get breaks in the DNA, and then it leads to a cancer. So it accelerates aging and age-related diseases. It disrupts hormones, like we've mentioned. It also damages the gut barrier. So your gut microbiome, increasing leaky gut, and decreases your beneficial bacteria. So it increases the bad bacteria, decreases the good bacteria. You get leaky gut. Leaky gut leads to chronic conditions. So you're looking at also toxins. So it acts as like a toxin carrier. It interferes with your cellular energy. So it wreaks havoc. We want to stay away from them.
Yes.
So Yeah, it's going to wreak havoc with your blood, your lungs, your liver, brain tissue, placenta, breast milk even. So it's just something we need to stay away from. So what can we do? Avoid heating food in plastics, use glass or stainless steel, filter your drinking water, but this one's important. Increase your dietary fiber because it binds and
Okay.
excretes.
Thing.
Yes, dietary fiber is important. Very, very, very important. So, and support your gut, support your liver. Stay away from ultra processed foods because your body's trying to get rid of this stuff. So you want to support your body's functions to get rid of the microplastics. There's also some very interesting breakthroughs in medicine and medical technology and what's happening. So if you really want to get the plastic out of your body, you got to do plasmapheresis. So take your blood, take it out your body, put it in a machine, take out the plasma, take out the plastic, put it back. And there's so plasmapheresis, plasma exchange, but there's also this company that's developed a filter. Instead of plasma exchange, it's filtering your plasma, and what it does is it's absorbing the microplastics. So that's very exciting, something to watch for.
I did read very negative reviews from a few doctors that say it is absolute marketing.
Okay.
Because I also thought, oh, amazing, I need that. I want everything out. And then I was reading a few reviews and they're saying it's not conclusive and they must
It's
do long
interesting.
term studies, blah, blah, blah. So, but yes,
Okay,
at least
interesting.
people are finding solutions. I think that's great. At least,
Exactly. So what you need to remember is that there is many different kinds of opinions, and how do you, this is an important topic, because what do you do when one doctor says one thing and another doctor says another
another,
thing,
exactly.
and another and another? And you will find that because there's different types of education that people have done. Is this doctor trained in plasmapheresis? Has he done the research on it, or is he just saying no? Because when I was a med student, doctors who didn't know much about things like vitamin C drips or this or that, they would just say no, not interested. But now when people do, certain oncologists will say, okay, you can actually have a vitamin C drip when you have your chemo treatment because they've done the research and the studying on it. So sometimes you can find differing opinions. Look at what they've
Yes,
researched. Look at their area of expertise. Are they experts in this field, or are they just a
yes,
doctor with an opinion on something they don't really know much about? So I think if you're going to follow an opinion, let's go deep into someone who studied to be a doctor and they actually have a solid foundation in training in functional medicine. So, functional medicine is more about systems and things, but science based. So, everything that a doctor
yes.
is saying needs to be based in science. And one of my professors that taught me, David Haas in America, has got the biggest private plasmapheresis clinic in the country. He's the expert on it. And this man is just, oh, he's got a heart of gold and loves helping people. He's really someone whose opinion I absolutely respect. So if anyone
Amazing.
wants to look into plasmapheresis, they should look into David Haas and a lot of the research coming out of their
Yes,
facility.
that's amazing. Okay, I'm going to look into that because I love to know. I think the one thing I always check is, are there long-term studies on this?
Yeah. So if you think about it,
Amazing.
the plastic in your blood is in your plasma. So if you're taking
Yes,
out plasma and your body has to make new plasma, then you're taking out some of the plastic and your body is making new plasma. So you're cleaning out some of the junk.
cleaning it out, flashing. Yeah,
Yeah.
absolutely. Okay, perfect. So my next question is, okay, what is your rule of thumb for maintaining female health?
Okay. So if I had to give the one piece of advice to women
Yes,
for their health, support stability, stable blood sugar, stable nervous system, stable routine, stable sleep. So women thrive on rhythm and safety, and when the body feels safe, the hormones regulate more effectively. Now, I am someone who hates routine and rigidity, and I like freedom and flexibility, but actually even myself thrives with a sleep routine. Your body thrives on routines like circadian rhythm. So if you can get your circadian rhythm in a nice rhythm where your body is going to sleep at a certain time, waking up at a certain time, and you're getting your deep restful sleep, you're going to have a brain that has decreased inflammation. And when your sleep is an absolute foundation for your wellness, and including hormones and everything, and mood. Stabilizing your blood sugar is vital, because when you don't stabilize your blood sugar, you get insulin resistance and diabetes, which is terrible because that is going to increase inflammation in your body. So resistance training increases your metabolism, increases your muscle mass, improves your cognition. Do you know they did a study, and multiple studies, but what is the one thing that can decrease your chance of dementia with age? Is muscle mass.
Oh, amazing. Wow.
More muscle, less dementia. More muscle, less frailty. More muscle, less diabetes and insulin resistance. More muscle, higher metabolism, leaner body. So
Yes.
building muscle is incredibly important. So stabilizing your sugar with exercise and nutrition. So when we go stabilize blood sugar, I'm talking about exercise, nutrition, and sleep. Stabilizing the nervous system, all your vagus nerve stimulating things. So what are the pillars of the foundation of health is what I'm actually touched on now, which is nutrition, exercise, sleep, stress management, and then an important one, your relationships. That is the foundation for your
Yes.
health. If you can have stability on all of those fronts, you're winning.
Absolutely. I love that. It's so true. It's finding your balance with everything.
Yeah, exactly.
I want to go back to that last question's answer, because you obviously mentioned exercise and movement and strength. And now that I know that you were personal trainer and everything, what is your favorite type of movement that you think most benefits you physically, mentally, emotionally?
Okay, that's easy. I absolutely love strength training. I get the most
Oh,
benefit
okay.
from strength training. So I go and I train one muscle. Right now, I've got a program where I'm doing one muscle group a day. So, say I'm doing back today. So, resistance training in the gym, actually, because I can't find a way to load my muscle as effectively training at home. So, I don't have endless amounts of time to go and train. I need
Yes.
efficiency. So, I need to go into the gym and I need to get bang for my buck on time. So I slowly, progressively warm up my body on resistance training machines, not on the cardio. So I will warm up on the machine. So if I'm doing back row, I'm warming up on the back row lightly, then progressively increasing the weight, and then I'm pushing hard. And then I move on to the next machine, next machine. And then I alternate on my days, and it depends, but sometimes I'll do a little bit of cardio training at the end, just for cardiovascular health. So sometimes I'll do intermittent training, but you've got to watch that you don't overtrain, but you've got to watch that you do the resistance training and you get your cardiovascular health. And then I do always a with a little bit of a meditation. So I do a full body stretch and then I lie down and I just let the endorphins flow, flow, flow. So definitely, if I have to pick one, it's strength training, but you actually need a balance, and you need, if you do strength training, you must always stretch so you prevent injury. So when it comes to women who really want to own their bodies this year, like go and join the gym and do resistance training, and focus on building muscle. How do you build muscle? You've got to do resistance training and eat the right amount of protein. Women do not eat enough protein. You're not going to build muscle like a boy. It is so hard to put on muscle. So I don't want you to worry about looking like a Hulk. You are not going to look like a Hulk. It's very,
No,
very.
it is. It really is, especially as you get older.
Yes,
Um, yeah.
exactly.
Okay, so my last question is, as a generation that is facing menopause down the line, we've had some really amazing information coming out recently about hormone replacement therapy. And so the whole attitude towards it has kind of changed and embraced it. And also, I think the type of medication that was in the past, I mean, we've got now different medications. So my question is, what is your feeling towards women facing menopause? Are we in a better position than say, for instance, our moms were? And
Yes.
are we better looked after?
Yes. So I love this question because there was so much misinformation and everyone is scared
Yes.
out of hormone replacement, which is really, really sad, because even when that study came out and my mom was on hormone replacement, I was like, you've got to get off. And it was the worst information I could have given her. So that study was flawed. When you look at research, you have to understand a little bit about how a research study is designed to look at if what the result was, you can actually interpret as true. So
Yes.
taught this in schools on how to understand research. What makes a good study that you can extrapolate evidence from, and what makes a bad study. So the study was flawed in what it's portrayed, and they did a new study, and it was actually really interesting, some of the information that came out. So what I can summarize for you is that hormone replacement therapy needs to be done by somebody who understands a holistic picture for you. So it needs to understand that first correct cortisol and adrenal issues and make sure thyroid. So it's a whole body look. Somebody who understands holistic medicine, who understands that you need to get the foundation of health right. Then you look at personalized hormone therapy. Why? Because you can't just go on bloods and labs. You have to look at the whole person, what they're experiencing. Sometimes if they're having sleep disturbances, don't actually go and prescribe them some sleeping pills. Actually look at, are they just deficient in their progesterone? And you look at estrogen progesterone ratio. So very personalized medicine, not a one size fits all. Then the next thing you want to look at is bioidentical hormones, not the synthetics from long ago. Long ago, they used equine urine, so horse urine, to develop a hormone, and it worked for what it needed to. But actually, rather you go for something that is absolutely structurally identical to your hormone, bioidentical hormone. So that is bioidentical estrogen, bioidentical testosterone, bioidentical progesterone, not progestin. Progestin, synthetic, not good. We want to go with bioidenticals, everything. But then what people don't realize is you must never be on unopposed estrogen. You want to be on a balanced estrogen progesterone. And actually it was really interesting because they said estrogen is promoter of growth and progesterone limits the growth. But I literally just saw a study just before coming on here where they have, and I need to go into the details of it and check that it's a good study, but it seems to be peer reviewed by quite a lot of people, where they put people on estrogen only and it decreased it was a group of BRCA positive patients, the gene for breast cancer, and being on estrogen only didn't increase their chances of a breast cancer. So it was quite phenomenal.
Oh, wow.
It was quite interesting. So there's a lot of beautiful, exciting research out there. So do not be afraid. Do not be put off by ignorant people or doctors. Remember that when you go to med school, you study everything broadly. Go to somebody who's an expert in that thing and ask their opinion. Don't ask a colorectal surgeon what he thinks about something he doesn't really know much about, because sometimes when you get super specialized in your field, you can have an opinion, but it's not fully educated opinion on something else. So people must always go for a couple of different doctors until you feel one. Your body will know when you feel one that sits right with you. Don't just go to the first doctor that comes about. Go to somebody who really gels with your way and what you feel is right for you.
Yes, absolutely. Okay, perfect. I just wanted to ask you, do you have any upcoming events or collabs or exciting partnerships coming up in the next few months? And then also, what are your contact details if someone wants to get hold of you?
Okay, perfect. Thank you so much. So I do have a couple of exciting things coming up that I've been working on for everyone. One is a 21-day reset for your gut, reset for your hormones, for weight, for detoxing. So 21-day health reset coming up. And that's the foundation for a 3-month program that I've been working on. Functional medicine becomes quite inaccessible to the general population because it's very expensive. But there's foundation principles that we can educate people on. So it's like having group functional medicine consults. So I'm working on that kind of principle and making it very much accessible, but it wouldn't be completely one-on-one. But there are foundational principles that I'm trying to educate people on, and I want functional medicine accessible to everybody. So it's the foundation 21-day program and then a 3-month intensive, really optimize your health and it's going to work on every area, every organ system to optimize you in that. So those are the upcoming exciting programs that I have. And my contact details, so you can reach me on my website. My website's www.drangelique, ANGELIQUE.com. Or you can find me on Instagram, which is DR, and you can reach me any of those ways.
Thank you so much for joining us today. It's been so informative. Thank you.
Thank you so much for having me. It's been great.